Examination of the paranasal sinuses is indirectly. Information about their condition is gained by palpation or inspection of the overlying tissues. Only the frontal and maxillary sinuses are accessible for examination.
By palpating both cheeks simultaneously, one can determine tenderness of the maxillary sinusitis. And pressing the thumb just below the eyebrows, we can determine tenderness of the frontal sinuses. To test the adequacy of function of the olfactory nerve, the client is asked to close her eyes and occlude. And then, the examiner places aromatic and easily distinguished odor. For example, alcohol, vinegar, or coffee. In this video, we used alcohol and coffee. After that, ask the client to identify the odor. Each side is tested separately, ideally with two different substances. In assessing the mouth and oropharynx lips, you must inspect for symmetry and surface abnormalities, color, and edema. In assessing for the temporomandibular, you must palpate while the mouth is opened wide and then closed for crepitus, deviations, and tenderness. In assessing the gums of the patient, you must inspect for color, bleeding, and retraction of gums. The normal findings should be pinkish in color, no gum bleeding, and no receding gums. In assessing for the teeth, inspect for number, color, dental caries, dental fillings, and the alignment and malocclusions or two teeth in the space for one or overlapping teeth. You must also inspect for tooth loss, and breath should also be assessed during the process. In assessing the tongue, you must palpate for texture. Some of the normal findings should be pinkish with white taste buds on the surface, and no lesions noted. In assessing for the uvula, you must inspect for the position and color. The cranial nerve 10 or vagus nerve is tested by asking the client to say "ah." Note that the uvula will move upward and forward.